Now, Donald Trump's possible choice for Secretary of the Department of Health and Human Services, Robert F. Kennedy Jr., might be the president-elect's most controversial move so far. So what will he do if he gets the top job? Let's get the views of the healthcare reporter at Politico, Alice Ollstein. Hi, Alice.
Hello.
Alice, good to have you on the show. Let's start with the big one, the elephant in the room. What's going to happen to vaccine policy if RFK Jr. is appointed in this top role?
So there's a lot that could happen. I mean, the most important sort of power that he could have, is still an open question, is sort of using what we call the bully pulpit. It's basically putting the message out there. And he is promoting a message of vaccine skepticism, which is really concerning to a lot of people in the public health world and the medical community. Obviously, vaccine skepticism is already on the rise in the United States. That was true for COVID-19. It's also true for some of the routine childhood vaccinations. And you're seeing, as a result of decreasing vaccinations in certain communities, a resurgence in diseases that were all but eradicated before. So there is a concern that, he has talked about doing more research, putting out the research for more transparency. There's concern that he or his allies could cherry pick data in a way that exaggerates the risks of vaccines and downplays the benefits and the efficacy. But there's also a lot of regulatory levers he could pull to dictate which vaccines are covered by insurance with no cost sharing, which are recommended for which age groups and which vulnerable populations. And so there is a lot, both sort of symbolically and concretely, that he could do if confirmed.
I mean, does he have an argument that Americans are over-vaccinated, or that there's a conflict of interest with the pharmaceutical companies and the profit motive to get Americans vaccinated?
Well, when it comes to preventive care, which vaccines are preventive care, experts really say that it's not a moneymaker. It's honestly a money loser for a lot of this, because companies would benefit from treating sick people more than preventing illness. It's just by the math, by the numbers. And so I think there's a concern that reducing these vaccinations could lead to a lot of preventable infections and a higher cost for all of us.
Well, indeed. And the idea that children aren't getting the vaccinations, the routine vaccinations, as you said, that they need, which could be life-saving, is deeply worrying, and seeing the resurgence of diseases we thought were consigned to the dustbin of history. However, do you think the authorities have a case to answer regarding the vaccine mandates in the course of the pandemic? Suggestion perhaps that if you'd had the COVID-19 vaccine, you weren't going to get the illness, you weren't going to spread it, you were going to save grandma. That hasn't quite borne out, has it, with the data? It may well, the vaccine, have saved millions of lives, but it didn't stop transmission or infection. So do you think that the authorities, misspoke at the time, at the height of COVID?
I think what's really hard for a lot of people to understand, even very well-educated people, is how science evolves, and how to communicate that is so hard. And so people heard authorities say one thing that they believed based on the evidence at the time, but as more data came out and as the science evolved, they updated those recommendations. Now that's what you're supposed to do. You're supposed to incorporate new evidence and update your recommendations. That's how science works. But to a lot of people, that read as mistrustworthiness. Oh, you used to say one thing and now you're saying another. Why should I trust you? So I think there was a real failure to educate the population on how we're just real time with a very new threat, what to do. And so I think maybe communicating from the beginning, look, this is what we know right now, that could evolve and change, guidance could evolve and change, and that's totally normal.
Makes a lot of sense. Now, RFK Jr., we're told, is going to tackle obesity, Alice. How's he going to do that?
So it's interesting. A lot of what he wants to do and has spoken about, things like the food pyramid, that's not even under the purview of the agency he was nominated to run. And I think that speaks to both his lack of familiarity as well as a lot of the other nominees that have come out recently, a real lack of familiarity with how the federal government works, what agencies do what, how they interact with one another. And I think that could really hamper their ability to execute on some of these major agenda items that they have. The federal government's very complex. HHS employs tens of thousands of people, has a budget of over $1 trillion. And not only do they lack experience in the federal government, they lack experience managing any big bureaucracy of any kind. People who have held this role in the past have been governors, for instance, who have that kind of experience running a huge workforce and a huge bureaucracy. And so there is skepticism from the sources I'm talking to, including former health officials, that they'll be able to do some of these very ambitious things they want to do, especially because, as my colleagues and I have reported, they are not doing the prep work right now that incoming administrations have always done, coordinating with agencies. And the reason they're not doing that is because they've refused so far to sign these ethics agreements that would give them access to federal agencies before the inauguration. And so you have the combination of an inexperienced sort of team of outsiders, which wouldn't necessarily be so bad on its own, but that compared with the lack of prep work going on right now is really of concern to a lot of folks.
Do you fear that RFK Jr. is a threat to American public health?
So I'm hearing from people who do fear that. Like I said, the way he communicates about vaccines, even people who agree with him on other topics, like you said, about obesity, about maybe children being over medicalized. He is open to doing more research on the medical benefits of psychedelics, for instance. And so even people who agree with him on some of those other things, and that's across the political spectrum, you have people on the left and the right, they still say, his views on vaccines are so disqualifying that we are concerned that he could make even these other good causes sort of lumped in people's minds with the conspiratorial beliefs and do a discredit to them instead of advance them as they are hoping. Now, we don't know what's going to happen. I think the confirmation hearings will be really illuminating in terms of how he plans to address some of these things, whether he can calm the fears of people in Congress about some of his past statements and beliefs. I think that'll really be a key test.
Indeed. And does he have a point? Is he right to be concerned about Ozempic being the answer to obesity rather than a change to your diet? Does he have a point there?
Well, Ozempic is always paired with a change to diet. That's how it's prescribed and that's how it's used. Now, I do think that it's interesting because that is another form of preventive care. Let's prevent obesity rather than treating it, right? But on other areas like vaccines, he is opposed to some of these preventive measures that could prevent, healthcare interventions that are more aggressive down the road. He also wants to slash the federal workforce. And so I think that also calls into question the ability to really make progress on a lot of these major initiatives. You need manpower, you need investment to affect the big changes they want to see.
Well, indeed. And look, Ozempic and other treatments of that sort have proved very popular, quite successful for many people. Are folk worried they're going to lose their Ozempic jab?
Well, I mean, again, the federal government can do so much of who it's recommended to, for whom is it covered by insurance. There's going to be a fight over that for sure, because there's worry about these very expensive drugs really kind of breaking the bank here and raising people's insurance premiums, even for people who don't use it, just to sort of spread that cost around. Now, is using it also going to prevent other treatable things and save money in the aggregate? We don't know yet. This is very new. And so I think there is just a lot of unanswered questions right now. And again, that's why I think these confirmation hearings will be really key in sussing out what are these nominees' beliefs on a lot of these things.
Well, indeed, I look forward to reading your reporting on that. It's going to be of critical importance if he's going to get the top job. RFK Jr., apparently, we're told, is going to look at corruption in the healthcare industry too. Will he find any?
Oh, well, again, this is an area where you have rare agreement on the right and on the left, but you also have a very interesting tension between calls for more regulation and calls for deregulation within the Trump circle, within the Trump administration, as it's emerging right now. And so it'll be interesting to see whether they prevail. Some of his nominees are more corporate friendly and may push back against some of these efforts. And so there could be some interesting inter-cabinet fights in our future that will be fascinating to cover. And we'll see if, big business, big agriculture, big pharma will, often they prevail, not always. The Biden administration was able to pass drug price negotiation over the objections of big pharma. And so whether the incoming Trump administration will be able to take a stand like that remains to be seen.
Now, Alice, Alzheimer's, cancer, obesity, and mental health illness are through the roof in America. Why is the US so unwell? What's gone wrong? This is the most sophisticated, richest nation on earth. Why are Americans not healthier, do you think?
Well, that's a very big question, and it really depends who you ask. I mean, we also have, when it comes to infectious diseases in particular, experts constantly tell me we have this boom and bust mentality where we don't invest in public health when there isn't a crisis. And then when there is a crisis, we, run around with our hair on fire and throw trillions of dollars at the problem and just try to address the immediate, but we don't build the infrastructure to really prevent that in the future. And as soon as the crisis passes, we disinvest again. And we're seeing that happening right now. We have these troubling outbreaks of bird flu happening, and there just isn't a surge in, testing resources and other outreach. And it could balloon into a crisis in the future if not mitigated. And so, that is just one of many factors, I think, that is plaguing the US health system.
Most definitely. Last but not least, and by the way, you're clearly a picture of health yourself, so you don't need RFK Jr. to give you the once over should he win. But can I ask you finally about the food industry? We talked about the pharmaceutical industry, the healthcare industry. What about processed food? What about the food giants? Do you think this new administration will take them to task, and should they?
It's fascinating because, it's fascinating to me politically because the conservative position has always been get the government out of my business, get the nanny state, don't tell me what to eat. There was a real backlash when under the Obama administration, when Michelle Obama took on healthy eating as one of her signature initiatives, there was a real conservative backlash to that. So it'll be fascinating to see if you get a very different reaction when it's coming from Trump and RFK Jr. and conservatives. I can't wait to see if it'll be completely different or, again, sort of a resistance to that kind of messaging.
Alice, it's been a delight to have you on the show. My thanks to healthcare reporter at Politico, Alice Ollstein.